Hello, everyone, and welcome to episode 10 of OB Clarity with Dr. Godfrey. I'm Dr. Godfrey, PhD RN, and today I must tell you that the topic is not going to be an easy topic, but it's definitely a topic that we all must face. Today, we're talking about a topic that reaches deep into the heart of obstetric nursing: grief and loss in the newborn period. No, this isn't an easy conversation, but it's one that every nurse, especially every future OB nurse, needs to be prepared for. Because in our world, joy and sorrow often exist side by side. One room is filled with the cries of a healthy newborn, while next door, there's silence. And in that silence, there's a nurse doing her best to help a family face one of the most devastating moments of their lives. I remember my own first experience with newborn loss. Long before I became a bereavement counselor, I helped moms get through very tough times, and the most difficult part was not hearing the heartbeat. A long labor, helping with induction, and in the end, the baby was not alive. The air was heavy, and it was still. I can still feel it today, how my heart ached for the parents. The parents were sitting quietly, holding their baby. There were no words that could fix it. And I realized in that moment, my role wasn't to fix anything. No, my role was to be there. Sometimes I sat in silence. Sometimes I handed a tissue. Sometimes I helped take footprints or a photograph. I lived in Hawaii at the time, and I would put little flower leis around the baby. I created one small memory that the parents could hold on to. Those moments changed me. They taught me that grief doesn't always need words. It needs presence, compassion, and gentleness. As nurses, we carry these experiences with us, right? When we lose a patient, especially a baby, we don't just leave that at work. No. We take a piece of that memory home, and sometimes it weighs pretty heavy. So I want to say this clearly to every nursing student and new nurse listening. You are allowed to grieve too. Yes, you are allowed to grieve. You can care deeply and still be professional. You can cry after your shift and still be strong. Healing doesn't mean forgetting. It means allowing yourself to honor that baby's life, to remember that family, and to use that compassion to guide your care for others. So when you encounter loss in your OB rotation, remember, every family's grief will look different. Yes, some will cry loudly. Some will say nothing at all. Some will ask why. And others will just stare into space. Your job is not to have all the answers. Your job is to meet them where they are. Sometimes the most powerful words you can say are, "I'm so sorry. I'm here with you." What you don't want to say is, "Well, at least it wasn't that long. At least you didn't get to know them. You're young. You can try for more." We don't know that. So we want to avoid those type of words, but never underestimate the healing that comes from your presence, from sitting quietly, from listening, from letting someone know they're not alone in their pain. I've learned that as much as we pour into others, we have to refill ourselves too. After a difficult loss, take a few moments for yourself. Step outside, breathe, reflect. Talk to your colleagues. Debrief with your instructor or counselor if you need to. It's okay. Because compassion fatigue is real. And taking care of yourself is not selfish. It's necessary. If you've already experienced a patient loss, please know you are not alone. Every nurse who's walked this path understands that pain, and we stand with you. And if you're preparing for your first OB rotation, I encourage you to approach each family, each birth, each loss with grace and empathy. You will never forget those moments, but you will also never forget the strength, love, and humanity that shines even in the midst of loss. So thank you. I know this was different this time. I know it's difficult, but it's real. So I want to thank you for joining me for this very special episode of OB Clarity with Dr. Godfrey. If this episode touched your heart in some way, share it with another nursing student or nurse who may need encouragement today. Together, let's keep learning how to care, not only for our patients, but for ourselves and for one another. So until next time, stay compassionate, stay resilient, and keep finding clarity in the care you give. And remember, always assess. Don't guess.